Ibanda district joins Kasese, Mpigi and Kampala in having Marburg suspects.
Wednesday last week, we got an alert that 2 boys were admitted in Ibanda hospital with a history of fever, headache and bleeding tendencies. And we took blood from these 2 boys. They have so far tested negative. We are not releasing them. We want to repeat their blood samples.
The State Minister for Health in charge of primary health care, Sarah Opendi, says Ibanda and other hotspot districts in western Uganda like Kabarole and Kamwenge shall be monitored more carefully.
In Ibanda, there are areas that are known for there are bats. There are several bats in some of the caves in Ibanda.
The other 2 probable cases in Mulago Hospital Isolation Center, however, had no contact with the first Marburg victim. It now raises questions on whether the problem is getting bigger.
We have 149 contacts whom we are still following up as a ministry for possible signs of the Marburg.
And any person who presents with signs and symptoms similar to either Ebola or Marburg, we shall always isolate and investigate.
The 5th suspect in Nancy's at Entebbe Isolation Center, which had been prepared since an Ebola alert in West Africa. And until the country is declared free of Marburg, with no threat of its relative Ebola, which has now killed over 4,000 people in 3 West African states, the ministry will continue cautioning the public.
If anybody develops sudden onset of fever and general weakness, bleeding from the nose, the ears, the anus, and also having vomiting of blood and bloody diarrhea, we appeal to the population not to go ahead and touch any of the body fluids in such a case.
The Marburg and Ebola viruses penetrate easily through the mucous membranes of the body, mostly the eyes, the mouth and the open wounds. Research into treatment and vaccines for the 2 deadliest viral diseases is ongoing worldwide, with experimental drugs being given to patients in West Africa, America and the UK. Uganda is also on board.
Especially our research institutions, Makerere University, are very much interested in Ebola. They are carrying out a number of researches, especially on rapid diagnostic tests for Ebola, on use of serum for treatment of Ebola, and they need to be supported.
And talking of support, Airtel Uganda has given about 150 telephone handsets to the Ministry of Health.
That are going to be distributed to every health center, 2, 3 and 4, in the districts that are prone to the disease and the outbreak. These handsets will be fully loaded with 530 minutes per month of free calls, 100 SMS messages per month, and 500 megabytes of data.
The Ministry of Health is appealing to other partners to join in containing Marburg and be on the lookout for Ebola. Florence Nalimba, NTV.